absence of our chair. Recording in progress. George Doucet, acting as temporary chair of the Ashland County Health and Human Services Committee. It's 4:15, June 17, 2026. And we should begin with the roll call, please.
Okay, I have to say his name. Clarence Campbell. Clarence Campbell. Laura Negro. Laura Negro. George Doucet.
Here.
Elizabeth Franick.
Here.
Beth Garrett. Here. Dr. Horning.
Here.
Joy Hendrickson. Here. Terry Verville. Terry Verville. Dr. Keller.
Sure.
Yeah, a quorum at 6 out of 9. Okay, so next we would have to move for approval of the agenda. Do I hear a motion for the approval of the agenda? So moved by George.
Motion approved. Pranic.
Manic will second, I guess. Okay, is there any discussion on the agenda? There being no discussion on the agenda, we'll vote on the agenda. All in favor of approving the agenda, please say aye. Aye. Any opposed? Any abstentions? The agenda stands approved. Next we move on to item 3, which is approval of the minutes from the April 22nd, 2026 meeting of this committee. Do I hear a motion for approval of the minutes?
Move to approve the minutes.
Beth Garrett, move to approve. Is there a second?
Second.
Dr. Horning is the second. Is there discussion on the minutes of the April 22nd meeting? If there be no discussion, we'll vote on this. All in favor of approving the minutes, say aye. Aye. Any opposed?
Aye.
Any abstentions? Minutes are still approved. At this point, we enter into the public hearing of TY. What's this TY stand for? It's just for calendar year 2027 budget development, and it has an asterisk on it. Terry, can you explain the asterisk, please?
It's just,
At the bottom.
yeah.
This makes it more at the bottom. Keep going further.
So it's just saying,
Oh, it's on the back of this
Yeah.
page. Okay.
yeah. If we get to a point where there's no public testimony, the hearing may be recessed to present other agenda items, but can be reconvened should new citizens appear within the time allotted for the hearing.
So, need a motion to enter a public hearing?
Yes.
We probably do. So I hear a motion to enter a public hearing of the 2027
I think for roll call.
budget. So moved by Terry Barningham. Second.
We need a roll call.
Beg your pardon?
Roll
Oh,
call.
it's a roll call vote?
Yeah.
Okay, call the roll, please. If you would.
Okay, did somebody make a motion?
Motion.
Motion by Dr. Horning. Is there a second? Second by Joy Hendrickson. Discussion on the motion.
No.
There being no discussion, we'll have the vote.
George Doucet.
Yes.
Elizabeth Franick.
Yes.
Beth Garrett. Aye. Dr. Keller.
Yeah.
Dr. Horning.
Yes.
Joy Hendrickson. Yes. Okay, that's all this is.
So we're now in public hearing. Are there any persons present who wish to speak at this public hearing? Do you have a sign up list?
Yeah, there's two.
Okay, so first on the sign up list is Anna Nevela. Anna Nevela present?
Yeah.
Do you like to make a comment regarding this budget of the coming year?
No.
Okay. The second person present is Rick Olivo. Rick, would you like to make a comment?
No, I'm just here to cover the news.
Okay. Is there anybody present who would like to make a comment on the 2027 budget? Is there anybody online who would like to make a comment? Is there anybody online who'd like to make a comment? Is there anybody present or online who'd like to make a comment on the current year 2027 budget development process? There being no comments, I recommend we recess the public hearing until we close business on a regular meeting. Require a motion for that? No, okay. So the public hearing is in recess. Next on the agenda is the public comment pertinent to agenda items, resolutions, ordinance of the day germane to the topic within the jurisdiction of the committee. Are there public comments on the agenda of the day? Anybody present, with public comment on the agenda of the day? Is there anybody online with public comment for the agenda of the day? Is there anybody present or online with public comment for the agenda of the day? There being none, we'll move on to item number 6, which is discussion and action items. The first being item A, overview of department roles and mandated services. Is there a speaker to this item?
Yeah, each of the department heads is going to touch briefly. So we're going to start with Terry Oviska.
Hi, everybody. So although my program is not a mandated program, it is something I'll just give an overview on and what we can and cannot do within our program. Requirements to enter into our program is they have to have Wisconsin MA. And what's the program name? Oh, sorry, it is our comprehensive community services. Thank you. Yes. So our program serves mental health and substance use diagnoses. So ultimately they have to have either those diagnoses coming in, one or the other or both. And that needs to be by a doctor or psychiatrist or an APNP on our form and Wisconsin MA. It's 100% voluntary. No one can be forced into our program. And once you are enrolled in at any point, they can choose to discharge. Our program is very rehabilitative focused. So we do not do anything for it. It is all side by side skill building. It's teaching. Our goal is to have you eventually not need us and to be able to back out of those services. So with that said, we also don't do things like texting or emailing or transporting. We teach them like the BART bus and how to get around themselves independently, how to make those phone calls to providers, whoever that is. Basically, if they have something, if their mental health or substance use gets in the way of them being able to do something, whether that's cleaning their home, any of the above, we can help side by side teach them how to do that and kind of navigate that. Any questions?
Erica.
Hi, I'm Erica Fido. I'm the manager of the Children and Families Units here at Ashland County. So for mandated services, we have youth justice, which falls underneath chapter 938. So that is when children ages, 10 through before they reach the age of 17 when they commit a crime. We have an intake conference with the youth and the family, determine jurisdiction, try and work with the family where they don't go to court, but if it's serious enough, we end up, usually going, to court and having court services. Then also underneath 938, it's called JIPS, which stands for Juvenile in Need of Protection or Services. That usually stands for youth that are uncontrollable, that have behaviors that can't be managed, in the community or in the home, and there's extra services that are needed for the youth and the family. Also, we have Chapter 48, which is Child Protective Services, which is child abuse and neglect, which falls underneath obviously physical abuse, neglect, sexual abuse. And there, reports are made to our agency. An intake worker will enter into our state system. I would do the screenings on that. We determine then if an initial assessment is warranted by the state standards. Try and offer services to the family and assess. Safety is a big thing that we are assessing with children and families. And then sometimes there's cases go to court for ongoing services. If there was the abuse or neglect was, that's serious enough. Some other mandated services is licensing of foster homes, which falls underneath Department DCF 56, which is Department of Children and Families. Taking any access intake calls, community members calling, asking for information and referral for different services, ideas, for some assistance with families and youth. Also, we have the kinship program, which is the Department of Children and Families, DCF 58, which is offering monetary assistance to relatives that are caring for children. And That is the majority of the mandated services. Does anybody have any questions or concerns? Beth?
By and large, do you feel you have enough resource to protect the children in the county from any of the above issues?
Enough. That's a really deep question, Beth. Um, and Terry can help me out with this one too. There's always a need for more, you know. I would say here as a whole and as workers, as staff, we try the best, to keep children with family, and that is really the push, for the state of Wisconsin, is we are trying to work more with less, as in, natural supports and like I said, family, and working with, depending on, the needs and that. But again, there's always that need for more. You always wish that you could have more, whether it's, more staff, more housing, help with housing, help with, to eliminate a lot of, stressors into homes, help with addiction, families that, have addiction and generational trauma and that. So I would say, I don't want to say just no, but we always try and do, as best we can with less. That's how we work. We have been for years.
And I'll just add, we've had challenges recruiting staff, so that's been an issue for us. Our neighboring county pays substantially more, and they have more staff. So we have concrete evidence to that. The Bayfield County had 312 intakes, and we had
So we had 312.
we had 312 intakes, and they had 100.
Last calendar year, the state just put out, numbers, because we use the state system, and Ashland County on this for CPS reports, so it'd be myself, screened 312, and Bayfield County did 134.
And they have more staff. But on a larger level, I think resources have changed through the years, and as Erica pointed out, our focus is really keeping children with their families. And so we've been able to use some creative things that weren't available to us before. So we can put services in rather than taking children away. We try not to utilize our wonderful foster families. If at all possible, we want to place the child with somebody they know and trust. So that's when kinship came in. Then we have subsidized guardianship, where people don't have to adopt, but they can get permanency without going through that whole legal process and terminating those parental ties. We have had stagnant funding for years. Most of the costs associated with placing children, that hasn't gone up. I'd say we probably pay 80% of that ourselves through levy. As far as bigger resources statewide, there are not agencies or group homes set up to deal with the complex needs of the children that we're seeing these days. So we've had to place out of state at times. Good news is the state is seeking a psychiatric residential treatment facility. They call them PRTFs. They're basing it on the Minnesota model, which it's a good blueprint for us. It won't work exactly for us because their laws are different, but that would really treat a lot of those complex high needs kids. Hopefully, I mean, that's our hope, that those resources, once they're in place, will help us keep children closer to home, not having to send them to Missouri or Pennsylvania or Arkansas. I mean, we've had to have kids placed far, far away. So that's kind of it in a nutshell, I'd say. I think we're moving in the right direction. It's just slow getting there. So.
Oh, any more questions? Up next is, Beth has a question.
Is there any child that you go to bed worrying about because we have to do something that's needed. I know it could be better, but is it ever dire?
I would, I'm going on my, 23rd year of child welfare services. I say there's always, that case where you think maybe we could do more, or it just doesn't feel right, but we know it doesn't fit the standards or the statutes and that. But it's,
Well, and sometimes we don't agree with
right.
decisions of the court. I've told Erica I have a case that haunts me all the time that we had to send to Arkansas, and she did not need to go in our professional opinion, and yet circumstances beyond our control mandated her to that facility. But we do the best we can.
Any other questions for Erica? Next up is,
Next is Tasha online.
yours, Tasha.
Hi, everyone. So similar to Erica, within the adult unit, we have several mandated programs and services that we provide. We have the Children's Long-Term Support Program, which serves children and youth with significant disabilities, helps them remain safely at home and engaged in their communities. We have 3 CLTS staff that provide eligibility determinations, service coordination, and oversight of individualized support, such as respite care, adaptive equipment, and other services that will help the families meet their children's needs. We also have the Aging and Disability Resource Center, which serves as the front door to information and long-term care services for older adults, adults with disabilities, and then also their caregivers and families. We have several ADRC roles, including the Elder Benefit Specialist, the Dementia Care Specialist, Disability Benefit Specialist, and ADRC Specialist. The ADRC programs help residents navigate complex systems, access needed supports, and maintain independence to remain in their homes and communities as long as possible. Another mandated service in the adult unit is mental health crisis services, and we contract those services directly with Northland Counseling, so they provide our crisis services and our assessments for individuals in mental health and substance use crises. And then we also have Adult Protective Services, or APS, which is a mandated county function that helps protect vulnerable adults and the elderly from abuse, neglect, self-neglect, and financial exploitation. When reports are received, county staff assess the situation, investigate concerns, coordinate services, and work with the individuals' families, the individuals themselves or their families, law enforcement, healthcare providers, and the courts when necessary. APS is an essential safety net that helps prevent harm, connects individuals to needed supports, and ensures the county meets its statutory responsibilities to protect vulnerable residents. In 2025 in Ashland County, we have 1 Adult Protective Services worker who handled 96 investigations, 7 new guardianship petitions, and 43 annual protective placement reviews. And those placements are located all throughout the state of Wisconsin. APS cases in general just continue to become more complex and time intensive for our staff. That's essentially the adult unit mandated services in a nutshell.
Questions for Tasha? Yeah?
This is Elizabeth Franek. I have questions when you can let me
Go
speak.
ahead first, Liz. Okay.
Okay. I'm not sure if this is pertaining to their departments or anything, but some communities, I'm not sure where, but they have social workers that are like a police officer when it's a mental health call, such as somebody with drug or alcohol going out of control, or children that are out of control. Instead of a police officer coming in, they would get the caller's permission to send in a social worker to calm the situation, long as it's not involving weapons or anything like that. Is there anything in the works for our county or neighboring counties that anybody knows of?
I mean, nothing in the works in Ashland County in particular that I am aware of. It is something that we have discussed at different times. There's a variety, between the level of need for that and then also funding and how you would, who would employ that position, who would kind of manage that. It's something that, with our contract with Northland Counseling, we're very fortunate that the workers there are oftentimes willing and able to work with the individual in crisis to hopefully avoid something like an emergency detention, to look at alternatives, or looking at just options to reduce kind of those big emotions or the situation, to minimize that, to hopefully not result in legal proceedings from that situation.
Thank you.
You had a question?
Well, I just wanted to note that I met Pauline Gordon.
Can you speak up, please?
I met Pauline Gordon of the APRC, I believe, and I just wanted to commend her for being visible at the farmer's market. She explained that she is really looking for an assistant or someone that she can she's been with us for 27 odd years or something like that. And I was just thinking how good it would be for there to be some overlap, if possible, so that she doesn't walk away with all the knowledge of having done this job. And we haven't had anybody there to hand that knowledge to. So, but mostly I was impressed with her dedication to her job, yet that she would take a Saturday morning to be at the farmer's market to talk about her position and the services that are provided. So I just want to put in the good word.
Any other questions or comments for Tasha? And up next,
Kelly.
I'm Kelly Maddy. I oversee the Child Support Office. So Title 4D of the Social Security Act was enacted in 1975, and that's when they created the Child Support Enforcement Program. If a child is receiving Medicaid, we receive a referral and we're mandated to work that case. Basically what we do is we do parent location. So we locate parents, we establish paternity, we do paternity testing, we establish court orders for child support payments. We review and modify those orders, and we manage all the collections and we enforce them. So if someone's not paying, we will bring them into court for contempt. We try to work with them first. We will issue a warrant for them to be arrested and work with us. If our warrants are only good in the state of Wisconsin, so if we have someone that's not paying that lives in Missouri, we'll ask Missouri to take our order, register it there, and enforce it. And as well, other states will ask us to take their order, register it, and enforce it. You do not have to be on public assistance to get our services. Anybody can walk in the door and apply for our services, and then we are mandated to provide those services. Even if you don't apply for our services, anyone who receives child support, there are people that are not on public assistance that get divorced and there's child support, or they get divorced and there's maintenance. We enter those orders, and then our system that we have keeps track of all that money, the receiving and dispersing of all of that money. We don't provide those services unless those people apply for our services, but the money does essentially route through our system that we manage. Yeah, that's what we do.
questions or comments for Kelly? So who's up next?
Liz.
Liz.
Oh, do we want Liz to go, or do you want me to go?
Whichever. You look like you're ready. Go ahead.
Amy, all right.
It's all good.
I just know this is a very long and impressive list. And
Don't apologize.
mine was a lot shorter. I'm the one who does the annual report with no pictures, so figure I better get in there while the getting's good. My name's Amy and I'm the economic support supervisor. So our mandated services are Medicaid programs, which you probably know as Badger Care Plus. There's elderly blind disabled Medicaid. So any type of Medicaid, we typically determine, not all of it, but most. We also determine food share benefits, which is also known as SNAP. Caretaker supplement, which is a type of financial assistance for adults who are SSI eligible, meaning that they are disabled, not working, and they have an SSI benefit. This is an extra financial benefit that helps them take care of their children, those who do not also have SSI themselves, and are eligible. We also take care of child care certifications for Ashland County. So we do certified daycares for those who are not licensed and wish to be certified. Wisconsin Subsidies is another program that we also determine eligibility for. Wisconsin Subsidies is a daycare assistance program. So it's for working families or families who are engaged in any other type of eligible child care related activity, who are able to go to work and have some of their daycare expenses subsidized. Not the whole thing, but a portion of it. So every little bit helps. And then energy assistance is another service. We at Ashland County are not currently determining eligibility for this. West Cap is, and they're doing a very excellent job as well. So that's economic support, short and sweet. Any questions? Yes.
If someone comes in who speaks English as a second language or doesn't speak English, do we have the ability to?
Yes, we have interpreter services. Ashland County has our own interpreter service because we're required to. This is part of our civil rights and English as a second language requirements. And we also have one through the Northern Consortium, economic support. We're a little bit unique in what we do. We work with the Northern Income Maintenance Consortium, which is an 11 county consortium. And we have our own interpreter system there, as well as Ashland County for all our other departments has their own interpreter system. So yes, we got that covered.
Any other comments or questions for Amy? Anybody online?
This is Elizabeth Franick.
Yeah, go ahead.
I just had questions about, I can't remember if the restrictions have gone through yet for the SNAP program, not allowing certain items. Do we know if that's in effect, and has there been a lot of complaints about it, or are people just kind of going with the flow and feeding their children better foods?
I don't believe it's gone into effect yet. I know it's still on the table. It probably is going to pass. It has passed in a lot of other states. I don't really anticipate a ton of pushback about it. But no, to answer your question, no, it has not passed yet. One of the exciting things about economic support so far these last couple of years is that we have a ton of policy changes that are coming down. So, but that particular one has not passed yet state level.
Do we know with that restriction, is that gonna, are they gonna say, okay, now we can restrict the amount of funds that we're gonna send through? Is that part of that too, or do we know anything about the amount of funding that's gonna be for the SNAP program?
You mean like the amount of benefits that a member is able to receive, or are you talking about the funding to administer the program statewide? Or both?
Statewide, or both? Yes, both.
Well, because of the big beautiful bill, what is written in there, the funding already on a federal level has been restricted. There is an additional 25% burden that is on the state of Wisconsin. We are required to maintain our food share cases statewide underneath a certain percentage of error, which is 6%. And if we are over that 6% margin as a state, then we end up taking on an additional percentage of burden for the administrative dollars that goes into the benefits.
Historically, we also, the SNAP dollars themselves that actually went to our members, were historically federal dollars. Now some of those dollars are also state dollars.
Any further questions for Amy?
Thank you.
You're up with.
All right, Liz Klobacki for Public Health. So as defined by Wisconsin DHS 140, and the review that's associated with that, and state statute 251.05, we are classified as a level 2 health department. This classification specifically helps define what mandated services we are required to provide. As a level 2 health department, the general outline for mandated services that we are required to provide actually is 3 full pages of services, which I will not force you to all listen to me read through it line by line. There are a lot of additional statutes that are very program specific and outline a lot of different requirements as far as the public health department for what our programs have to include. Specifically, things that we are required to do or provide would be to have a strategic plan, which is unfunded for our department. We do a community health needs assessment and a community health improvement plan. We do partner with Iron and Bayfield County as well as Tamarack Health to complete this. This is largely unfunded for us. We are able to utilize some of our prevention funding for it, but as a whole, specifically for our department, it is largely unfunded. We are required to have public health emergency preparedness and planning, birth to 3 program, communicable disease control and prevention. Of note for that, we receive $3,200 annually to support communicable disease control and prevention. So essentially it is largely unfunded for all of the disease investigation and follow-up that we do for that. We are required to provide a maternal and child health program, which we do receive just shy of $10,000 in funding for that. However, it does require a 60% match, so largely unfunded for that program as well. We do provide and are required to provide a immunization program, which includes a student immunization program. So we do work with the school districts to provide immunizations on site in the schools. $7,514 for this year, which will be reduced next year because they have just redone the formula for immunization allocations. And we will be losing roughly $2,000 in funding for our immunization program. So that's wonderful news for us. We are required for environmental health services for childhood lead testing. We do receive some funding for that, $4,183 on an annual basis. Human health hazard investigation and control, including rabies program monitoring, both of which are unfunded. We are required to have a public health nursing program. So we do have walk-in clinic availability for individuals that come in with questions, looking for immunizations, reproductive health services, walk-in. We do not receive specific funding for that unless if we are able to essentially bill MA for fee for service for those, depending on what it is. We are required to have community education programs, but we receive no funding for those either. Additional programs that we do provide that are not necessarily required for us as a level 2 health department are family planning, reproductive health program services, overdose fatality review, harm reduction services, including Narcan Direct, fentanyl test strip distribution programs. We currently are a recipient of the statewide crisis intervention program, which at this time we are utilizing that for hunter safety education as harm reduction. We are also a debt cap agent of the state, so we do have an agent licensing program. And with that, we do have a water monitoring program as well. We work with the DNR for TNC, transient. I'm forgetting the abbreviation of my alphabet soup here. Businesses that are on private wells, we conduct their annual water monitoring for Ashland and Price County. And then we also participate with the Lake Superior Beach Monitoring Program.
See, I told you it was gonna be impressive.
That's the short version.
And you have how many staff?
I need to count down my hallway. That's so sad. I should know the answer off the top of my head. 6 of us? That sound right? 6 of us.
I know that there's an independent agency or something that ranks counties by their overall health indicator. I'm not certain that I buy their.
You don't want to know
metrics.
our ranking.
I think I do know. We're down there pretty far.
It's not the greatest ranking
Yeah,
there, no.
yeah. Anyway, I appreciate public health. I wish we could find the dollars. It would be so good for all.
Sure.
Where does the housing authority, where is that in? Where is that under? Who's that under?
The housing, they're their own separate.
They're their own separate,
Mhm.
okay.
Other questions or comments for Liz? Other questions or comments from Liz online or present? I just have one question. I just want, as an example, so the immunization program
Mhm.
has this small amount of funding, which is really inadequate. But is that funding for supplies, or is that, what about staff and facilities part of that? Is the staff and facilities in a different budget, or are they part of what you're talking about?
For the immunization program specifically, and I'll use the schools when we go into the schools as an example, the vaccine supply that we receive for that is specifically provided by the state. So the state receives their own share of immunization funding, and then so they keep a pot of it for themselves, and then they distribute out pieces to local health departments and partner agencies based on what their formula allocates to them. So from the money that the state keeps for themselves, they're able to specifically distribute immunizations through the Vaccine for Children program and the Vaccine for Adult program. So the flu immunizations that we receive are provided actually through the vaccine. It's a combination of the Vaccine for Children, Vaccine for Adult programs. So we don't actually have a direct cost to us for those immunizations specifically. The supplies and the staff time and the transportation, the Band-Aids, the alcohol wipes, the sharps containers, the hand sanitizer, everything that goes with actually administering the immunizations then would come out of part of this funding.
And then this funding can't cover all of that expense, can it? So
Nope.
where does the rest of that get absorbed?
Tax levy.
Okay, but that's a line item in your budget still, or is it a different line item of the budget on that?
We are able to cover for the flu immunizations, we're able to use part of our public health emergency preparedness funding to cover part of that as well, because it counts as a mass clinic exercise for us. We're very good at giving immunizations. Our COVID immunization clinics is an example that's very similar to how we set up and run our mass school immunizations, where we have a very specific pattern and flow of work, and so we conduct a exercise on an annual basis by doing the flu clinics for us, in addition to the other immunizations that we also provide.
So then, since there's inadequate funding in so many of these categories,
Mhm.
what are we unable to do that we want to be able to do?
How
Did I
much
just have a long
time
list?
do you have?
Be here for one night,
How about the top 3?
Oh, boy. We would really like to provide additional community events as far as like reproductive health clinics. We would like to be able to expand the services that we're able to offer. As far as availability of point of care testing for reproductive health services. Kind of general health services would be encompassed in that as well. That's one of my top ones. As far as like childhood lead testing, we are able to bill MA for some services through, like if a kiddo has an elevated blood lead level, you know, let's say their lead level comes back at 7. That's getting to be pretty significant. So we're going to provide education, follow-up, recommendations for follow-up testing, venous confirmatory, if it was a capillary, that was the initial test. And then depending on where the individual is residing at, how old their home is, if it's a pre-1978 home, we can offer to conduct a environmental lead inspection. So we actually have a certified lead inspector on staff who can then go there and collect the dust wipe samples. We can borrow the XRF from the state, which is a really cool, essentially point and shoot. It'll tell you how much lead is in a surface. MA only reimburses $800.
And MA refers to,
Medicaid.
Yeah.
Yeah, so they only reimburse $800 for a full lead risk assessment. Depending on the size of the home, it can take, the last one that I assisted with was a clearance. So essentially everything was lead free. It still took 2 people over 4 hours. Because it's very, like, you have to measure the windowsills, you have to measure the window troughs. When you're doing dust wipe samples, you have to do a 12 by 12 square area on each floor in each room. And it's very specific how there's actual directions on how you have to wipe the floor to collect your dust wipe samples, and everything needs to be packaged and labeled. And
we have all these old homes now.
yeah, it's fantastic.
Any other questions for Liz?
Yes, this is Liz Brannick. Go ahead, you can go first.
No, I just wanted to point out we may have somebody here for public comment. I mean,
Yeah, we need to identify. I didn't know if this was a staff person or not.
it's not.
We have someone online identified on screen as Rob O'Clair. Could you please let us know your purpose? If you're here for comment, we can resume the public hearing toward the end of our order of business. Could you please let us know your purpose? But you'll have to unmute. Yeah. Thank you.
Rob Player here. I was hoping to make a public comment. I just jumped on, just got off of work, so I was just gonna see where we are in the agenda.
So we're working our way through the order of business. We started the public hearing at the beginning of this meeting and put it on suspension until toward the end of our business meeting. So we will come back to that if you want to comment at that time.
All right, then I stay online listening.
We could have him comment now, couldn't we, too? Because we just left it open. So I don't know what other people think, but if you.
Is there any objection to receiving public comment from Rob O'Clair at this time? Being no objection, Rob, go ahead.
Yeah, thank you. I just wanted to make public comment on the status of Wellness and Recovery Court in Ashland, Ashland County. I know everyone's aware that, several months ago, there was some tough funding decisions that had to be made around it. And just, as a concerned community member, I wanted to, I guess, shine a light on it, and maybe it can be put on a future agenda item in a future meeting at some point. I'm from Bad River. I work in Bad River. Many of the participants in Wellness and Recovery Court were Bad River tribal members, and now they are currently, unfortunately, many of them are back in jail. And I know on a personal level, many of them, having grown up with them or just grown up around them, they're not doing well, and I'm not saying that's, all because of, the closure of wellness and recovery court, but it didn't help. Many of them were doing well, and I know several people that have went through the program and changed their lives because of it. So I guess I just wanted to shine a light on it, bring it back to the attention of everybody. Maybe there's an update about it that I'm unaware of, and maybe there could be um, like public tracking or announcement or something to the public around its status, or and its potential, coming back, like its potential future. I mean, these wellness and recovery courts, that they got a proven ability to improve outcomes. They reduce recidivism. The studies are there. Outcomes are positive because of it. I've seen it personally. I'm in recovery myself, so I've seen, many people that I've known for a long time thrive because of it. And I'm unfortunately seeing people not thrive, the opposite of thrive now because of, partially because of it ending. So I guess I just wanted to, like I said, shine a light on it, bring it back, make it, hopefully spark a discussion, see if there's an update or if there could be an update made at some point around it. Thank you.
Thank you for your comments, Rob. We welcome that. We will resume our order of regular business, but we will hold the public hearing open for further comment at the end of regular business if you should like to make a further comment. At that point, have we completed roles and mandated services? Or is there more?
Unless Liz had a question.
Liz had a question.
Yeah, I had a comment or question about the education to the public awareness about certain new drugs that are coming down the pike. I've heard of on Facebook and by word of mouth, I've heard of pink cocaine. I've also heard about purple fentanyl, and I think there was a third. And I heard that purple fentanyl is lethal, Narcan resistant, and there's another one that was Narcan resistant. So I was just wondering if there's any public awareness for that and to educate the public. Thank you.
Is there input for Liz on that question?
Yeah, we have had some information out. I believe it was in April. I know we had one post specifically that we had put out regarding Medi. Oh, how do you
I
pronounce
don't know. Metadine or something.
something to
long.
that effect? I always get stuck halfway through it. It's also referred to as Medi or Rhinotrank. It is the essentially big brother to xylazine, depending on the concentration, anywhere from 100 to 300 times stronger than what xylazine would be. Again, it is typically used as a veterinary medicine, and it has been mixed in some instances with fentanyl. Narcan is ineffective as far as alleviating it, or a reversal agent, and the withdrawal symptoms from it can also be significant for an individual as far as instances of extreme hypertension, cardiac dysrhythmias, and a few other significant side effects that are specific to withdrawal from that. So we have had some information out on that. Unfortunately, we are unable to provide test strips specifically for it as of yet because they are still considered contraband. So we are unable to purchase those within the United States at this point in time.
Other questions on the subject?
Thank you.
I guess this is for you, Terry. And that is, are partnerships with Bad River possible with their public health or their health and human services, family services, I guess they call it? Because I know they have access to funding that non-tribal member or orgs don't. And it would seem to me that it might strengthen both programs if there was more partnering. Is that, what are the obstacles to that? Partner a lot, when we can.
Yeah, I mean, whenever there's a possibility to collaborate, we try to collaborate. However, being that they are sovereign, we're held to higher rules sometimes than they are because they're sovereign. So sometimes it's just not feasible because they may be doing something that's very effective the way they're doing it, but it wouldn't meet our statutes or our reviews. But they've proven through the years they've got some really great programming and they're really proactive. So anytime we can invite them to join us, we try to, and I believe Rob's example of the WRC was a perfect example of that when we had that funding. The tribe was very involved. I mean, we had a tribal judge who was part of that teaming. So yeah, anytime we can, but there are kind of different rules because of each of our oversights.
That makes a lot of sense. Thanks.
Are there any other questions or comments on public health? Well, since we're talking about drug, I have one. And since we have some medical expertise around the table here, it seems to be an emerging issue, not really an issue yet, but it has to do with these glucagon-like peptide weight loss medications. And I've read concern that these will become broadly available and inexpensive, and misuse, misregulation by people who think they can manage it by themselves may overflow into our environment where people are worried about diabetes and weight loss. And I wonder if anybody has any insight into that issue. And if not, at least I wanted to raise it, put it on the table and think that's something we might run into in the future. Abuse of that prescription medication.
I don't think there's been any movement to make it so it's not a prescription, so there should still be medical oversight.
I mean, you can pay for it out of pocket and buy it. You know, you can buy it right from Lilly, the pharmaceutical company, but it's still quite expensive.
I think the concern is it will come down and be manufactured on a generic level, maybe imported from international suppliers, and become like pain medications were a prescription, but they became a real problem in the black market. So just wanted to put that on the table, and we should move on, I guess. Are we then wrapped up on mandated services?
Yep.
And which takes us to the 2026 year-to-date expenditures. I guess that, Amber, you there?
I sure am.
Okay. Well, yours.
Okay. So I think you guys got copies. I did include last year's and this year's, and this is all the expenses and revenue received through the end of April. Pretty much right on target. Not a lot. You know, we're pretty early in the year, so it's hard to really analyze too deep, but 28% in expenses is looking like we're just under you know, for being on track to what our budget is, which is a good thing. Our revenue, you'll see our grants revenue is down a little bit, but we usually are receiving revenue about 2 months behind. So that's pretty normal on that leg, and we'll see that change when we get closer to the end of the year. We'll have more grants and less levy for a little while yet, once that catches up, till we get to the end of the year. So nothing, I don't see any red flags yet. Looking like we're, you know, on target for the moment. Hopefully we can stay there. But other than that, really not a whole lot to report on any of these numbers just yet. But does anyone have any questions for me?
Any questions on either 2026 or 2025? It's also part of the package. Any comments? There being none, thank you, Amber.
Thank you.
We can move on to public health update. Get to talk again.
Just wanted to highlight a couple of things that we have going on right now. The first being we have an AHEC intern this summer We actually have Angela Amron with us for the summer. She is specifically working on a lot of the moving pieces for the 55 plus health and wellness fair that we will be putting on in partnership with the ADRC and the Enrichment Center on August 19th. It will be at the Civic Center and the Breading Center. So she is making lots and lots of phone calls and outreach to try to coordinate with all of the vendors and to have health screenings and all of the different moving parts with that. So we are very excited for that coming up. We are also, as I mentioned in our programs that we have in addition to the mandated services, our hunters education classes for harm reduction. We are having a few more of those being confirmed as far as planning. There will be classes coming up in July in the Butternut area. So it is being hosted at the Butternut School, but it is open to anybody that would like to attend. Registration info is posted on our Facebook page, or you can go to the DNR Go Wild website to register for that. And then I just wanted to give an update as far as our social media as well, as far as outreach. We have in total 2,836 followers on our Facebook page, which I think for a public health Facebook page is a pretty decent number. We've actually had 22 new followers in the past 30 days, which is pretty typical. We do see increase in numbers over the summer months. People like to check out the page because we post the beach status updates. So we usually gain a few more people over the summer months. And on average, our followers, actually 49.5% of our followers are age 35 to 54. So, any questions?
Any comments? Anybody online with a question or comment? So we move on to written materials. Just offer, does anybody want to raise questions or comment as to the written materials? Hearing no comment, we move on to board member updates. Can you start with you, Liz Frenick? Any updates from you? With suggestions for a future agenda?
Not for a future agenda items, just like I had said before, I want to keep the public aware of those different drugs that are out there that are potentially fatal, and public health problems that could be arisen from our population influx that's coming. And it's going to affect everything from, the area with, say, for example, a restaurant that I work at run out of food and have to close for 2 hours because they don't have another truck till Monday. It could be affected more because another restaurant is closed right now, but I'm thinking, is this area really ready for this many people coming into the area? There's not enough employees at certain businesses. I'm wondering how it's going to affect if somebody has to go to the ER and the flu season coming up and all that. I just want to keep all that kind of a topic people can talk about if they have questions or comments or anything about their issues that they're having, and homelessness, of course. Thank you.
Then we'll go around the table. Beth, do you have any updates or comments for future agendas?
Yeah, I guess one agenda item that I'd be curious about is if you see your role as a county board supervisor as somewhat of a diplomat and a liaison between community members and the county, what would the Department of Health and Human Services love to have us letting the community know when we're interacting about your needs? I think making sure that community members know that taxes go to important services And to kind of elevate that. What especially would you want? So just a little note about how should we present the good work that the Housing Human Services do and their most key needs. So
Looks like
that
an opportunity for an agenda item for your next meeting, Terry, unless you want to talk about it now.
No, I'm wondering how to word it.
me too. I find it on the agenda. And I know that I had asked about the children. Are we keeping our kids safe? And I omitted the same follow-up question when we just went right from there to the elderly. Are we keeping our elderly safe? And I really did appreciate your thoughtful answer, Erica. I thought it was very balanced. And so I think as another board member takeaway for me is keeping our ears open for bringing resource into this department and that might be organizing volunteer things or finding grants and forwarding or advocating, like I say, for parity in how the levy is distributed and things like that. That's it.
Any questions or comments regarding Beth's thoughts? Move on to you, Joy. Anything?
I guess a follow-up to what Beth said for an agenda item is, one thing we're aware is the county population is aging very fast. And do we have the resources to keep up with that aging population? I know that it's brought to my attention every now and then. People that need guardianship, people that need housing services, etc. I know, speaking from the hospital setting, we oftentimes end up housing them for a very long time until we can find a safe place for them. And, if we could get some of those things lined up before they end up at our ER, that would be extremely helpful and less costly.
Comments?
I just need to make a comment because that's bigger than what Health and Human Services. It might be better served at the full county board to bring it to them because we don't have any jurisdiction over that. I mean, I think the ADRC has a plan for, they call it 2030, so they're trying to plan for this, but some of the things that you mentioned, like I totally agree with you. There aren't enough healthcare providers. There aren't enough personal care providers. They can get on family care, but what services are they getting because there are no staff? But that's nothing, like that's beyond our control or, I think it's a bigger picture. I think everybody pretty much is aware of it. Well, not everybody, but it's definitely a topic at the state level because it's not just here, although we're aging a little faster than other populations. But it's the whole system of care. So yeah, I agree with you totally.
Was it Kelly Westland that did kind of like a project for Bayfield County, similar concept, and I think
More housing related,
it
yes.
was more housing related, but it was a similar topic, aging population, and her focus was housing for the aging population. So I don't know if something similar could be done for Ashland County.
We do have a question. There are a couple of questions specific to housing and an individual's feeling of their ability to maintain in their current housing situation for the next 5 years that were addressed in the community health needs assessment. So that is something that we will be working on again this summer, will be the next community health needs assessment survey. So that information will be in there again. So that would be something that would, we could help to identify in there. There are also just released, I think there were 5 different notice of awards for the Rural Health Transformation Act. They're very large grant opportunities, would not be something specifically for one agency to undertake, but potentially a regional effort for something. And I don't remember what they all were off the top of my head.
Weren't they more focused on, you had to have a new initiative per se to get that grant money, if I recall? It was,
I don't think all of them were.
yeah, I mean, there was a
know-
lot of money earmarked, but a lot of it was
Yeah.
kind of like you almost had to offer a new service, if I understood that, like. Which is,
Yeah,
which we could come up with something new, maybe.
right. I don't know if it was.
Let me throw in here that, even though this is not within the empowerment of this department, if something were going to come to the county board would probably look to this committee to raise the issue, even though it's not within the, capability of the department as it currently exists, because there's no other place in the county structure that might raise this kind of a question. So
Well, then you could bring it to the full, you could ask that it be put on the full county board
yeah,
agenda.
that's the kind of thing that we want to discuss here in this committee first, even if it's not within the operational purview of the committee. There's no other place to have a preliminary discussion.
So do we have to put it on the agenda at this level? So
I
that we
guess,
can get it to them?
I mean, none of us are experts in this, so I'm not sure that we'd be valuable or a good resource for you.
Just a starting point, yeah. So okay, maybe we can discuss this further. It's not going on the agenda right away, I don't think.
Okay.
Dr. Keller, you're up.
Well, even my dog is old. An issue with widespread, and I agree with, that's probably not something as a committee, we're gonna do much about. Unless we put things in the water.
Then our water people have to monitor that.
Any questions for Dr. Keller on his comments? I have nothing, so Dr. Horn, you're the final word.
Great. Well, I mean, I say this a lot, but budget development for the public hearing is on our agenda, and I continue to want, and I don't know if it's here or it's at the full county board, but trying to figure out how to have Spark be like a consistently budgeted item over time. I know we have grants. Grants have been great. It's been a great program. It's wonderful. We all support it, but I feel like we need to institutionalize some of these programs so that they have longevity and sustainability. And I continue to, I was just at that community picnic thing that they had with the Planet Youth now, Check Play organization, and it's great. And you read the sort of mandate of the department, and there's a lot of youth focused stuff on prevention and even on treatment, and Spark is doing all of those things so well. And so I guess that's certainly something I think feel obligated to say often at these meetings. Another thing that came up is, especially when Erica was presenting, but other people too, if our staff aren't being paid evenly with area agencies, we, if possible, should try to look at that in this budgeting process as well. That's fair, equitable. It also helps do the work that we know is so needed and so valuable. So I guess those are things. And then the comments about the wellness and recovery court, I know we talked about this at the meeting, maybe back in like January-ish when that happened, or February, but if that's something, maybe there, I mean, when we talked about it before, we didn't really have a clear, what do we do next? How do we either message this to the public or try to, because it's beyond us, right?
Yeah, well, and the issue is if we don't have a judge, we don't have it. But I will just put a plug in for the TAD program, because they are trying to get funding to do a like program that is not federally funded. And there is just some information that came out through the National Counties Association on Monday, and then there was a webinar on it today, that those grants that are passed down from the federal government are going through a lot of changes. And it's been made clear to me on 2 different occasions now that there will be the ability for the federal administration to pull those grants at any time, whether you're in the middle of a project or not. So I agree with the TAD program at this point. If we get the DOJ funding, which is separate than an allocation from the feds, that's probably a better way to go. And so that is not through our agency, but that's through, I believe it would be like law enforcement and public property. Because it's run by the sheriff's department and the deputies. And of course, the judge is involved in that too. But they are trying to mirror it like the program that we had. So there will be a lot of similarities if we get the grant, is my understanding. But hopefully the funding will be more consistent. It's pretty scary to make this wonderful plan and then have like what happened to us in January.
Yeah.
I mean, at 9:30 at night, we got notice, you're done as of today. And because I'm always checking my email, I knew that at 9:30 at night. Like, what? So, and then like Rob said, you're in a situation where there's real people affected by this. And it's a horrible situation. So, yeah, I think I think what Tad is trying to do is a great thing.
I want to open one other aspect of this agenda item. Is there anything from anybody in the staff or around the table, in addition to the funding problems, that you want us as county board members to be thinking about and taking back basically to our county board meetings? Anything particular in addition, other than the funding, which we know is a problem almost everywhere? Okay. Next time. So we're going to go back now and reopen our public hearing on the 2026 budget. So if there's anybody present in the room who would like to comment on the 2026 budget, anybody online would like to comment? If Rob Leclerc, you're invited to come back online and comment if you wish. Hearing no further comments on the public hearing, I would like to hear a motion to close the hearing.
Motion.
Dr. Keller, second by Dr. Horning. Any discussion? Those in favor say aye.
Roll call, George.
Aye.
Roll call.
Fine. Thank you,
Roll
Dan.
call.
Okay.
Okay. George Bussey,
Yes.
Elizabeth Franick,
Yes, and I want to publicly thank Rob for speaking out. Thank you, Miigwech.
Beth Garrett,
Yes.
Dr. Keller,
Yes.
Dr. Horning,
Yes.
Joy Hendrickson.
Yes.
So it's present.
Well, public hearing is now closed. And so I think we're moving on to item 11, which setting the next meeting date is proposed for August 19, 2026 at 4:15 here at the Sanborn Avenue office. Are there any comments on this proposed date?
I won't be able to make it, but I bet everyone else can, so no need to change it for me, but I'll be around.
Terry, you want to stick with that date?
That'd be great. I mean, we should have the preliminary budget for approval. So then that it can go to the finance committee.
Okay, so as of now, we're planning on August 19 at 4:15 p.m. here for our next meeting. Given that, I'd like to say if there's no further business, meeting is adjourned.
Thanks for running the meeting.
Thanks, George.
No need a motion to adjourn when the business is complete.
No, we don't know the motion.
Not when business is complete.